Hi, in this video we'd like to come back on the discussion of recurrent miscarriage. We'd like to discuss another common cause that we observe in women, which is known as premature ovarian insufficiency, or sometimes also referred to as primary ovarian insufficiency, POI. So women who develop this condition generally is due to the fact that their ovaries are no longer functioning normally. So what does normal function of ovaries mean? So a healthy ovary will produce healthy amounts of estrogen and also release eggs regularly as per your menstrual cycle. So people with POI will start to lose both of these crucial functions. They don't produce enough estrogen, they are not ovulating as per usual, which will also lead to other complications such as osteoporosis. When there's very low estrogen, these women have very brittle bone, which can also cause some harm. So this condition definitely has its high risk groups. So high risk groups definitely have an age factor. The older you are, the more likely that you are have the risk of developing POI. But you may also develop POI in your early or fertile periods. We do not understand exactly what is the underlying cause, but we do believe that there must be some environmental factors or some genetic component that leads to it. So diagnosis for this condition is done by doing a blood test of your reproductive hormones. Figure out what hormones are lacking, what hormones are actually normal, so that we can identify your deficiencies. Next up, we also want to do a ultrasound of the uterus, of the ovaries, of the fallopian tube, and also the corpus luteum to figure out the development and also its any structural abnormality. Treatment in Antai hospital for POI is that we will administer birth control pills for patients with this condition. If used correctly, if you follow your doctor's instruction, these birth control pills, these contraceptive pills, will completely halt your ovaries' ovulation function to allow it to actually recover for a few months, because we here believe that POI is actually caused due to an ovarian fatigue. So these contraceptive pills will help restore and help this ovary that is fatigued to heal and recover its function. After a few months, as per instructed by your doctor, once you stop using these contraceptive pills, in many cases we observe that these women start to ovulate again normally, and also they can go on to have regular menses. They can go on to get pregnant because previously they are unable to get pregnant because of POI, and also they are able to sustain healthy full-term pregnancies and no miscarriages. So if you'd like to find out more information about POI, or you suspect that you know somebody has POI, somebody has irregular periods or constantly skipping their periods, or even no periods at all for multiple years, these people have a high suspicion of a POI case. And you can share them this video and ask them to seek treatment with us.